Hey guys, welcome to my channel. So in this video we are going to look at the arterial supply, venous drainage, lymphatic drainage as well as the nerve supply of the tongue. If you haven't watched our videos on previous videos on the anatomy of the tongue, that is the introduction, the dorsal and the ventrum of the tongue, as well as we have also video on the muscles of the tongue. So please make sure to watch it, and it gets easier if you watch those videos. So we'll begin with the arterial supply of the tongue. So arterial supply of the tongue is supplied by the ascending pharyngeal artery, the tonsillar branch of the facial artery, and an important artery called as the lingual artery. So arterial supply of the tongue, we have a ascending pharyngeal artery from the external branch from the external carotid artery. Then we have the tonsillar branch of the facial artery, and finally we have an important artery that is called as the lingual artery. So this is a chief artery of the tongue. So from the lingual artery we have deep lingual and dorsal lingual. Deep lingual will supply the anterior part of the tongue, and dorsal lingual is going to supply the posterior part of the tongue. So revise it. Arterial supply of the tongue, we have three: ascending pharyngeal artery, which is branch from the external carotid. Then we have the tonsillar branch from the facial artery. Then we have the lingual artery, which is the chief artery of the tongue. So we have the deep lingual, which is supplying the anterior part of the tongue. We have the dorsal lingual, which is supplying the posterior part of the tongue. As you can see in this diagram, this is the by external carotid artery, this is the ascending pharyngeal, tonsillar branch of the facial, then this is the lingual, this is the anterior part, deep lingual, posterior part, that is the dorsal lingual. So moving on to the venous drainage of the tongue. So venous drainage, we have a main vein that is called as the deep lingual vein. So deep lingual vein is the principal vein of the tongue. Then we have some other veins, they are called as the venae comitatus. They come around the lingual artery. Then we have some other venae comitatus, they accompany the hypoglossal nerve. So from all this venous drainage, they will finally drain into the facial vein and the internal jugular vein. Again, what about the venous drainage? We have the deep lingual vein and some venae comitatus from the lingual artery as well as from the accompanying the hypoglossal nerve, and they finally drain into the facial vein and internal jugular vein. So this is about the venous drainage. Now moving on to the lymphatic drainage of the tongue. So we have basically four types of vessels. We have the apical vessels, marginal vessels, central vessels, as well as the basal vessels. Firstly, we will discuss about the apical vessels. So apical vessels will drain from the tip of the tongue and as well as the inferior surface of the tongue. Tip of the tongue as well as the inferior surface of the tongue, and they drain into the submental lymph nodes. So apical vessels, they drain from the tip of the tongue as well as the inferior surface of the tongue, and they drain into the submental lymph nodes. Then we have the marginal vessels. Marginal vessels will drain from the margin of the tongue as well as the anterior two-thirds of the tongue, and they finally drain into the submandibular lymph nodes. Then we have the central vessels. Central vessels drain from the central part of the tongue as well as the anterior two-thirds of the tongue, and they are going to drain into the deep cervical lymph nodes. And finally, we have the basal vessels, and these basal vessels drain from the root of the trunk as well as the posterior one-third of the trunk, and they are also again going to drain into the deep cervical lymph nodes. So what do we have? We have the apical vessels draining into the submental lymph nodes. We have the marginal vessels draining into the submandibular lymph nodes. We have the central vessels draining into the deep cervical as well as the basal vessels draining into the deep cervical lymph nodes. So this is about the lymphatic drainage of the trunk. Now finally we will go on to learn about the nerve supply of the tongue, which is an important part. So what about the nerve supply of the tongue? It has both the sensory supply as well as the motor supply. First we will discuss about the sensory supply. In the sensory supply we will discuss about the anterior two-thirds, and then we will discuss about the posterior one-third. So moving on to the nerve supply of the tongue and coming to the anterior two-third. Anterior two-third is supplied by the lingual nerve as well as the chorda tympani, which is a branch from the facial nerve. So sensory supply, anterior two-third supplied by the lingual nerve as well as the chorda tympani from the facial nerve. Then we have the posterior one-third. Posterior one-third sensory supply is by the glossopharyngeal nerve, which is the cranial nerve 9, as well as we have the internal laryngeal nerve, which is a branch from the vagus nerve, cranial nerve 10, cranial nerve 9. So this is about the posterior one-third sensory as well as the anterior two-third sensory supply. Moving on to the motor supply. All the muscles of the tongue are supplied by the hypoglossal nerve. So this is of the motor supply. All the muscles of the tongue are supplied by the hypoglossal nerve except palatoglossus. So palatoglossus is supplied from the pharyngeal plexus, which is found from the cranial root of the accessory. So all the muscles are supplied by the hypoglossal nerve except palatoglossus, which is supplied by the pharyngeal plexus, that is the cranial root of the accessory. So this is about the nerve supply of the tongue. So thank you guys. Thank you for watching video to the end. Please make sure to subscribe and hit the like button, and also share it to other friends if you found it helpful. And I'll see you in the next video. Bye.